varicose veins in pregnancy. Now, these are actually pretty common, and you would be surprised to know where you can get varicose veins. It is not just the legs. We're going to be talking about what they are, why you get them more in pregnancy, and what you can do about them. So we'll get to it right after this quick reminder.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Varicose veins, those swollen and twisted veins, are a common concern during pregnancy. They typically measure at least 3 millimeters in diameter and most frequently are found in the legs. But did you know that varicose veins can also appear in other, less expected places like the rectum or even the labia? We'll delve into all aspects of this topic today, from causes to symptoms and treatment options.
So let's start with the basics. What are varicose veins? Varicose veins are those enlarged and twisted veins that result from a condition known as venous insufficiency. So venous insufficiency essentially means your veins, which are responsible for returning blood to your heart, are not functioning properly. And this can lead to reverse blood flow or reflux, causing the blood to pool in the veins, which leads to them being enlarged and swollen.
Interestingly, varicose veins are more common during pregnancy than in the general population. In fact, they affect between 20 and 50% of pregnant people.
I feel lucky I didn't have any.
Me
Sorry,
neither.
guys.
I know. We're horrible.
Right?
However, the incidence can vary depending on factors like whether you include certain other things like spider veins in the statistics. So probably a little bit lower for true varicose veins.
Okay, I got some spider veins. So why do varicose veins become more prevalent during pregnancy? There are actually a couple of theories behind this. There's a mechanical theory that suggests that the pregnant uterus compresses and puts pressure on the pelvic and the iliac veins. So these are veins that sit in your pelvis that increases the blood pressure. And that contributes to the development of varicose veins because your body has to work harder to push against that pressure to get things back to the heart. However, the hormonal theory is more widely accepted. And so this theory posits that the increase in hormones such as estrogen and progesterone during pregnancy actually alter the pressure in veins. And progesterone in particular relaxes the walls of the veins like it relaxes so many other things in our bodies, and it makes them more prone to enlargement.
So there are certain risk factors that we know about for varicose veins during pregnancy. So these include how many pregnancies a person has had, family history. So if all of your female relatives have varicose veins, you're more likely to get them as well. Whether you have constipation, so this is because you have to push more to get the poop out, and so that increases the amount of pressure in your body. Obesity also increases the risk for varicose veins, and age. In fact, people who've had more pregnancies and have given birth more frequently tend to have a higher incident of varicose veins than first-time pregnant people. So just each pregnancy adds risk to getting more varicose veins.
Oh, we're so blessed. Carrying babies is a gift. It is, but it does a lot on your body. So now let's move on to the signs and symptoms. Varicose veins really can manifest in various ways. Some people may experience no symptoms at all, while others may actually notice bulging and almost bluish colored veins in their legs. And common complaints that people have when they have varicose veins include feeling like leg heaviness, finding exercise really difficult or almost being intolerant of doing any hard exercise. They may have pain or tenderness along the affected veins, itching, a burning sensation, restless legs at night, cramps, and even edema, which is swelling that's caused by fluid retention because your body is having a hard time moving all that blood and fluid back towards the heart.
So other than these symptoms, there are some things that can happen when we have varicose veins, which occasionally can be quite concerning. So these may include changes in skin pigmentation, and those pigmentation issues can last lifelong. Some people get more irritation of their skin or eczema. Sometimes the kind of the fatty tissue underneath the skin layer can get lost. And I know lots of people want their fatty tissue to be lost, but this isn't actually functional, and you can have little divots in your skin afterwards. You can get superficial thrombophlebitis. So this is an inflammation and irritation in those vessels that can be quite painful. And sometimes if you've got lots of vessels really close to the surface, you can have bleeding as well. And every once in a while, pretty rare in the pregnant people, this is more of a complication in older people, but you can get ulcers associated with this as well. They are not minor things, but it's important to know about what to watch for if you do have varicose veins in pregnancy.
Everyone knows that the best gifts are the ones that you buy for yourself. But how can you get that exciting gift opening surprise factor while also getting yourself exactly what you need? With a nesting box, of course. A pregnancy-themed subscription box filled with locally crafted, ethically sourced goodies handpicked by Doctors Sarah and Alicia to support you in whatever trimester of pregnancy you're in. From soothing soaks and balms for those first trimester aches and nausea to newborn products for when your baby arrives. We have you, or the pregnant person in your life, covered. Go to www.shefoundhealth.ca/the-nesting-box or click the link below.
So, after we've told you all the beautiful information about what can happen, you might be wondering about how we actually treat varicose veins. So, during pregnancy and the first sort of 3 to 6 months following birth, interventional treatments or surgical treatments really are not recommended unless there's something really exceptional going on, like significant bleeding or something else. But there are some non invasive approaches and even medications that can help manage your varicose veins. Some of these include pharmacological treatments or medications or sclerotherapy, and that's a procedure that involves injecting a solution into the affected veins to shrink them. Phlebotonics are another option that I have never heard of. And this might increase venous tone and help prevent edema, although the exact mechanism is not fully understood.
And let's just be clear, sclerotherapy can be useful for really small ones. So this is when we're talking about those spider veins that both Sarah and I got in pregnancy. But I don't think we can use sclerotherapy for those bigger varicose veins that most people really get bothered by in pregnancy.
No. And so for other treatments that we often recommend that are not interventions or medications include wearing compression stockings. So you can wear them to the level of the calf, and you can even get full leg length, which I know can be very challenging to put on, but they really can make a difference in helping.
Especially in those labial varicose veins.
Yes. And then the other thing you can wear is called a V2 supporter. Is that what it's called? And basically, it looks like a jock strap and gives lots of compression on the vulva and the labial tissues to help reduce the swelling there. And so we can link to some of those in the show notes below, just for folks to see as an option, because those really are what we recommend first line in the office. Medications generally would just be like Tylenol to help with any of the pain that you're having, topical steroid treatments if you're having any eczema or things like that. But generally, those interventions and phlebotonics is not something that we routinely recommend in pregnancy. It's a good old-fashioned compression stuff.
Yeah, and let's talk a little bit about the difference between varicose veins of the legs, which I think is what we all think about.
Yeah.
But we mentioned kind of rectum and labia as well. So the rectum, that's hemorrhoids. So hemorrhoids are just a swelling of the veins. So how do we decrease the risk of hemorrhoids? While keeping our bowels nice and soft, not getting into constipation. So we have a great podcast on constipation in pregnancy, which we'll link below as well. So keeping your stools nice and soft and staying well hydrated, which is sometimes easier said than done. And then our labial varicosities, the good thing about these is they actually go away after pregnancy. But you can have that same feeling of that deep ache, that uncomfortableness when you're sitting down, it's uncomfortable. So certainly if you're experiencing that, we can usually have a quick exam of your vulva and see if that's what's going on. But those, generally speaking, do resolve after pregnancy, after that big uterus has shrunk down to its normal size. So that's a really positive thing. Whereas the varicose veins of your legs and rectum generally are always there and may come back later in life to bother you.
Yeah. And so if you've experienced them during pregnancy and you're wanting to get a surgical intervention on one of the ones of the legs or even the rectum, we recommend waiting until you're done with, pregnancy. So if you're planning on having more children in the future or you're not sure, then we wouldn't recommend having a sort of in-depth procedure because there is a high likelihood that they would come back even after the procedure.
Yeah. And once you're done having babies, talk to your care provider around what you can do from a long-term solution. But certainly, as Dr. Sarah said, number one management, especially in pregnancy, is those compression socks or compression stockings, depending on where your varicose veins are.
Mhm.
And then from a bowel point of view, keeping your stools nice and soft.
And this is a little note to any of our Canadian listeners, is that if you have health insurance, oftentimes if you get a prescription, you can get some of those stockings and compression devices covered through your benefits plan. Not everybody, but just something worth knowing and looking into.
Awesome. So there you have it, an in-depth look at varicose veins in pregnancy. Who would have thunk there was that much details? But certainly make sure to check out our other podcasts and our Instagram page for more information. And don't forget, we've got great blog posts that go along with each of our podcasts if you like learning by reading.
Thanks for listening.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.